Okay, well, welcome everyone. This is our little session. On bone health. And so what we'll do is I'll switch to a presentation. So I'll share my screen with you, and then you'll be able to see that. At the end, we'll have plenty of time for questions. I'm in no rush to head out this afternoon. So if anyone wants to have a good old chat afterwards, you're most welcome. Or if you just need to head off, that's fine. I've structured it to be about 15 minutes to half an hour in length. Yeah, feel free to just enjoy it. So I'm just going to share my screen. Okay. Now, I can't see anyone of you because I've shared my screen. Oops. And so what you should see is a little presentation. And I'm just going to ask if you can't see it, can you just unmute yourself and just say can't see? Okay, good. I'm assuming that everyone can see. Now, even if you have issues with your recording, I'll be able to send anything out. So I'll talk through everything as well, so you'll be able to hear it. So what we're going to look at today is bone health. And so I've called it Standing Strong Health Bites because we're just trying to take a little nibble into each different thing around health because there's so much there. We want to just take it by bite-sized approach. So these are some tips to improve your bone density. And so that helps you to stay strong, stay resilient, and also to reduce your risk of injury in the event of, say, not only a fall, but as you might be aware, that some people can get like bone fractures from not really a fall. They didn't even have to do much and their bone broke. So sometimes bone density can get to that extent where it's quite fragile. Okay, so this is just some practical tips. The idea is that you don't need to list off all these different kind of university qualifications or literature or this or that and all this head knowledge. We want to just kind of go, this is actually just the practical know-how of how you can be confident that you are looking after your bone health. Obviously, being a physio, my experience is in the exercise management of it, as well as the mobility and balance and that sort of stuff. We're going to touch on things like nutrition and the medical side of things, and I'll give you kind of referrals out elsewhere if you want to follow them up with either your GP or with a specialist or with a dietitian or people of that qualification. But yeah, so there'll be time for questions at the end. I'll stop the recording at the end and we can have any questions. And then obviously if there's personal things that you wanted to follow up, feel free to email me and we can take that professionally and confidentially. All right, so enjoy. So what we're going to cover today is these three things. So bones, their common problems and the actions. So the bones, so what actually are they and what do they do? And that sounds like a simple question, but they do some things that you probably wouldn't necessarily realize if you hadn't been told. There's some common knowledge things that just, it's not common knowledge. And then the common problems. So we're going to look at the main conditions that affect bone health. And in this little kind of presentation, we're looking at thinning or bone thinning and breaks, and they've got more medical terms, but that's kind of the lay terms in terms of how we can think about that. Obviously, there's so many things that can happen in our body, and by no means is this supposed to be exhaustive, just touching on a few of the big issues to try and, just help orient you. And then what you can do about it. So what we want to do is feel like you go, okay, well, this is what it's all about. Where am I at in relation to my health, and is there any steps that I need to take to improve that? Okay, so that's all. So bones. Oh, excuse me. We have 208 bones in our body. That's a lot, right? If you were to count them all up. Some anatomists say we've got 206. Some say 208, depending on how you count your sternum. Your breastbone's actually made up of 3 bones. So, but you don't really need to know how many bones you've got to know how to keep them strong. But the thing is, there's lots of different types of bones. And so you've got things like your big long bones, like your femur, like your thigh bone and your shin bone and your arm bones, like these big structural things that hold you up. And particularly when we're talking about maintaining your mobility and improving your strength, we're targeting a lot of these big long bones, but also things like your vertebral column, which are kind of like an irregular shape bone. If you've ever seen one of them, they're kind of different, right? And at the end, I can bring up my little anatomy slideshow, and if anyone's interested, we can kind of break that down. That's kind of interesting. But different shapes. Some of them are very small. So you might have the bones in your wrist are sort of like pebble size. The bones in your inner ear that help you to kind of hear are really quite small. And then you've got ones that are kind of like involved in joints, like your knee joint, which they will have a fair degree of movement. And then you've also got ones like in your skull, which kind of like are more or less fixed, and so there's various shapes and various functions, and often we talk about structure and function. So the function is subservient to the structure. So obviously, if you have a certain shape, it's going to act in a certain way. The skull, for instance, is, you want to protect your brain, obviously, and so you don't want a whole lot of movement between the bones, right? Because that would be a threat to the brain. Whereas between your knee bones, you obviously need to have movement, and so you have to have a joint there that actually allows a lot of movement. So depending on where they are, there's a lot of different things there. And there are some obvious things that they do and some not so obvious things that they do. Now, I'm going to go through the obvious thing. Now, of course you would know this, but just going through this intentionally, sometimes you go, oh yeah, that's why I'm doing this. And sometimes it just helps you to orient. So the obvious thing is that they provide structural support. So they hold us up and they give us shape. So if we didn't have bones, we'd probably just be a blob on the floor, right? It would just be, it wouldn't be sustainable for life. And so, your shape or your general body posture or habitus is pretty much made up by the skeleton structure. So, even how we talk about that in a non-anatomical terms, when you talk about a skeleton structure for work and that sort of stuff, it gives you that overall broad shape, and that's what they do. And they also allow movement, which you would have known too, because the muscles and the tendons pull on the bones and they actually move the joints. And so what some people don't know is how this happens. So people go, well, what's the difference between a muscle, a ligament, and a tendon, and all sorts of, all these different types of soft tissues. So muscles are the only thing that can really provide movement, apart from gravity, of course. And so they provide movement by contracting or shortening. But muscles will generally be continuous with a tendon, and they will pull on the tendon, and that tendon is the thing that actually is kind of ingrained into the bone. And so think of muscles and tendons as kind of one continuous unit. You might see the muscle would be more like a red type color and the tendon would be more like a white color. So it kind of like fuses into each other, and then the tendon kind of fuses into the bone. So when the muscle contracts or shortens, it pulls on the tendon, which pulls on the bone, which moves the joint, and then you got movement. So that's pretty much what happens in most of the body. Every now and then you get a muscle that goes straight into a bone, but that's more the exception. Most of it is, the tendon. So, one example would be like in that tendon in the front of your knee, where your doctor might, put the reflex hammer. That's your quadriceps tendon, so the muscles in front of your thigh, and that tendon kind of encases your kneecap, and then it pulls it into the front of your shin. So when you move contract your thigh muscle, you straighten your knee. So that's one example of that. The other big tendon that you might know about is the one in the back of your ankle, your Achilles tendon, where the Achilles heel, we hear that term from. And so when you contract your calf muscle, you basically point your foot like a ballet dancer. So that's just how you can conceptualize that. So with obviously movement gets us from A to B, but it also, in terms of, your mobility, but also helps you to interact with your environment. So, to be really simple terms, my mobility with my walking might get me to the fridge, but then my interaction with the environment is I need the movement of my hands to actually interact with what's in the fridge. I love it how I've gone straight to there's lunchtime, obviously. Okay, and then the next obvious thing is protection. So we touched on this before, is that they shield organs and other delicate structures from injury. So obviously your skull is a big one. It protects your brain. And your ribs obviously protects your lungs and other and your sternum, and protects your heart, and there's other important structures and blood vessels and things in there, and obviously your pelvis too. So your urinary, reproductive organs, digestive health, all of that sort of stuff. Okay, I've just got to admit one more person. There we go. Bring that in. Okay, so hopefully that makes sense. So they're the obvious things. Now, the not so obvious things, points to you if you got all this, is energy and immunity. Now, you probably go, oh, yeah, I knew this, but it might not be something that you kind of immediately think about when you think about bones. It's usually when people go, oh, I've got a bone marrow transport and all that sort of stuff if you've had someone you've known with leukemia. So red and white blood cells and platelets are formed in the red bone marrow. So on the inside of bones, is kind of like a more like a spongy type part of the bone. The outside of the bones are generally kind of like harder and solid, and you get a lot of the strength from there, but the inside is more spongy. And the red blood cells, they carry oxygen and other nutrients, so that helps with obviously energy and muscle contraction. White blood cells are intimately involved in your immune system response, and platelets are involved with kind of your clotting response. Obviously, they do a lot more and different types of things than that, but in terms of the way we can think about that, they will provide energy for movement, help to fight infection, and help to clot blood in the event of bleeding. So if you've been on blood thinners for any reason, you realize what platelets do, and if we didn't have platelets, you would just bleed out. So that's a big problem. So yeah, so good that bones do that. The other thing that they do, and you probably go, oh yeah, I knew this too, but it's something that we don't often think about immediately, I don't think, is the storage of minerals. So there's a lot of important minerals in bones, and the common ones that we think about are calcium. So most people think, oh yeah, calcium bones, and phosphorus. And so if your body needs those two things for different purposes, right? If you don't have enough calcium in your diet, right, then your body goes, oh, I've got some stores of this in my bones. I'll release it into your bloodstream to use elsewhere. Now, can you see how that would be a problem if you were consistently not getting enough of these things and it kept leaching out of your bones into your bloodstream? Where isn't the calcium? It's not in your bones. And that obviously, through a few complex series of reactions, it basically helps to form crystals which keep your bones strong. And so you can only do that process so long without having an impacting on your bone structure. And so whilst that's a good thing in terms of your body being able to resource different things when you need it, if it's an unchecked process and it's a chronic problem, then often things like osteoporosis result. The other thing that you might not know is that fat can be stored in the yellow bone marrow. So this would not be something that would happen very often, because usually our body won't draw fat stores from the bone, because we've usually got plenty hanging around elsewhere. But in the case of people who are facing really like famine and that sort of stuff, you can actually get fat stores out of bone marrow. So there you go. So they do a lot of things. Now, the other really interesting thing when it comes to the spine is that when you when in the spongy inside part of the bone, right, the blood goes through there, and blood being part of that spongy actually reinforces it like a lattice. And so the blood itself strengthens your bone. So it's this amazing kind of interaction between blood being produced there, but also the blood provides like a splint into the bone as well. So it's this amazing thing that happens. So what we're going to go into next is the common problems. So there are many conditions that can affect bone health, and you can probably think of plenty of them. Some of them people are born with, and some people they develop. But really, we're just going to look at three. And I tend to think of these things as kind of like on a continuum. So at one end, you've got good bone health, and then it gets as your bone thins out. We talk about osteopenia. So osteopenia osteo just means bone. Penia just constantly means thinning. And so it usually just means that there's a decreased bone integrity is taking place, and there's more breaking down than building up. So what happens in the body is nothing's really static. It's kind of like an ongoing process of things building up and things being broken down, cells being renewed all the time. And what the body always wants a thing called homeostasis, which just means wants to be kept in balance. And so the little cells that are building up and making bone, they want to be kept in balance with the little cells kind of remodeling and breaking down bone. And the problem happens is when there's not enough of the builders and there's too much of the tear downers. And that's when you start getting, brittle bones in this business. So now, if this process is unchecked, further on you get osteoporosis, which is basically another level down. And you're like, what's the difference between these two? It's a little bit arbitrary. It's a bit of a statistical difference. And so usually they measure it, by bone density scans. You might have had one of them before, and you can see that, and you get like this little number of how many standard deviations you are away from the norm. So I won't get into that because it's a bit technical and tricky. The main thing is that osteopenia is kind of the start, and then osteoporosis is kind of like further down. Now, the further down you go, of course, it increases your risk of broken bones. And so this is the next part of the continuum is fractures. Now, this is a common myth. People go, oh, fracture, that's just a minor thing, right? Because we've been taught that, oh, that's a hairline fracture. No. Now, fracture just means any type of broken bone. So if you snap your leg in two, that's a fracture. If you have a hairline fracture, that's also a fracture. So a fracture is just any like discontinuity in the integrity of bone. And so most of these fractures, especially in the over 65s, are caused by trauma such as falls and sometimes car accidents, but the majority is falls. But if you have a condition such as osteopenia or osteoporosis, obviously, because there's less bone integrity, it's more likely that you can result in a fracture. And the other thing is, you might have heard this, is there's a term called minimal trauma fracture, which just means that, you might have just been doing the gardening, or you might have just been, getting out of a chair. And some people, if they've had osteoporosis that's been kind of untreated, maybe they'll get a crush fracture in their bone, or maybe they won't even know about it. They just get a scan one day, and then they realize they've broken something. And so this is what can creep up on people. And if you've seen someone who hasn't had osteoporosis treated, you can get that characteristic kind of hunchback kind of appearance that can be. This doesn't mean that everyone with that kind of hunched position has got crush fractures, but often people who've had osteoporosis have got wedge fractures in their bones, and so you just get that kind of deterioration. Okay, so the next part of the section is last part. Sorry, we're racing through is what can we do about it? So I think the first thing is let's know where you're at. There's no point treating something haphazardly if you don't know where you're at, right? Now, and I often hear this kind of argument where people go, oh, I've got muscle cramps, I'll take magnesium. Now, this is unrelated to bone health, but that kind of reasoning is like, well, do you know you've got low magnesium to start with, and usually go, oh, no, I don't. And so whilst magnesium can help with those things, you want to be able to know, do you actually have low magnesium to start with? So it's good to have a bit of a test, right? And so there's no point treating yourself for osteoporosis if you don't kind of have it or don't know where you're at, right? So obviously the first thing is a bit of assessment, a bit of a screen to know what is the state of my bone health. So have you been diagnosed? Has your doctor ever spoken to you about these things? Are you concerned about that? Do you feel more hunched over than usual? All this sort of stuff, right? Now, one little thing, and I'm going to share the screen in a minute, is this little self-assessment called knowyourbones.org.au, and I'm gonna bring it up here. So if you go to knowyourbones.org.au, you can actually check your bone health, and you would just press Start Assessment here. And, you would go through these kind of questions. Now, I won't do the whole thing, but for instance, if I was doing it, this is what I would do. And I would encourage you guys to do this because it only takes a minute. And you just go into your, your age. I've got a couple of years ahead of me compared to you. And then, have you ever fractured or broken a bone? And you can go through the different things, like so. And was this type of trauma minimal for this fracture? Which just means that, were you just standing there and you broke it, or did you actually have a car accident? So a car accident would be not a minimal thing, or a fall wouldn't be minimal. But if you just bumped it, that's minimal. Do you have a family history? Have you had falls? All this sort of stuff. And then you can go on. There's a few more pages and whatnot. And then they'll give you a nice little result. So I encourage you to do that, and it emails you a result and it gives you a few little recommendations, but it just helps you to think about these things. The next thing is like the nutrition side of things, and probably the two big things for bone health is calcium and vitamin D, which you no doubt have heard about. And so you can either take them through the diet or you can take them through supplements. Now, for a lot of people over 65, their dietary intake isn't anywhere near enough, and so that's why supplementation is often done. But the recommendation for the over 65s is about 1,000 to 1,300 milligrams a day of calcium, depending on if you're like male or female. Women have different needs post-menopause because of the effect of calcium reactions and that, but it's about that. Yeah, and vitamin D supplementation is recommended at 800 to 1,000 international units a day. Now that might make not a whole lot of sense. So that's when you start talking to your GP about, well, have I got this? I'll come to vitamin D in a minute, but if you wanted to look at, okay, well, how much is 1,000 to 1,300 milligrams a day? There's this site which is still related with this Know Your Bones business, is Healthy Bones Australia and Your Bone Health and Calcium. And if we if we go here, you can see some examples. So, dairy, milk, cheese, yogurt, usually there's about, up to 300 milligrams per serve. So there you go. You're getting a third, a quarter to a third just there. Seafood, different types of seafood has got a lot there as well. Lots of vegetables have different amounts, nuts and seeds, different fruits. Like calcium set tofu has a ton of it, as well. So, all this sort of stuff. So if you have a think about your diet and add it up, you might be going, oh, I'm getting pretty close here. And they've even got like different recipes and calcium content that dietitians have gone through. So you can look at it through there. And it also has different information on calcium in here. So healthybonesaustralia.org.au. This is it's a really good website, and there's lots of resources. Now with vitamin D, vitamin D is not really a vitamin. I'm just going to bring someone else in. But we form it through a complex series of chemical reactions when people get sunlight. And so one of the things that a lot of people in over 65s is that we find across the board, not necessarily you guys, but across the board, is that they don't get out and about enough, which means they don't get the incidental sunlight they need to start forming vitamin D, which is important in bone strength. And so it doesn't mean you need to be out sunbathing, but trying to get little bits of regular sunlight and incidental sunlight, often without sunscreen for those periods, is actually quite important. And you've got to balance that with the the use of sunscreen and other protection. So that's why we say, usually before 11 and after in the afternoon, when you can get even just 15 minutes, that's actually going to be really helpful. And the rest, if you've got gaps, is when you look at supplementation, and you can talk with your GP or dietitian about that. Okay, so that's that next bit. And now this is the exciting part, and then we'll finish up, is the exercise part of it. Now, this is obviously where we come in terms of what we're doing in Standing Strong, is that there's three main types of exercises that are like broad categories of exercises that are recommended in both prevention and management of osteopenia and osteoporosis. So the first is strength training. Okay, so that's like when we do big muscle groups, we're doing a challenging load, lots of effort, a fair bit of effort. We're making it harder over time. And so you should be really feeling it, so they're not just light loads, they're heavy loads. Generally, they're loads that you can't lift more than about 15 times. That's strength training, and you need to do that twice a week, non-consecutive days at a minimum. Though if you have diagnosed osteoporosis, we want to avoid heavy bending and rotation because that can actually increase the risk of spinal injury and fractures there. And so these are kind of the things that we do a lot of in our class. The next one is impact training. And so this is kind of like ones where we get those like impact and jarring loads, which actually stimulate the bone to regenerate. So this could be things like hopping, bounding, up and down stairs, kind of heavy stepping, jogging, jumping, all these sort of things. And these only need to be done little and often. So often about 50 reps. So, think about 50, maybe 5 sets of 10 repetitions of jumping up and down or something like that, in a session. And then you only need to do that you need to do that regularly, but it's only a little amount. So maybe 4 to 7 times a week. And often people are getting this naturally if they're out in the garden and going up and down steps, or if they're, going up and down hills and getting up and down the floor and all this sort of stuff. And so, but that really gives that bone a bit of a stimulus to say, hey, put more tissue down here. And so they're the top 2 things, strength and impact training. So that they're the 2 things that build bone. Now, the third category doesn't build bone, which is balance training. So balance doesn't actually help with your bone strength, but it decreases your risk of falling. And you can't really break your bone from a fall if you don't have a fall. And so that's obviously why we include that here. So each of these 3 things we do as Standing Strong, and we have a real particular focus on these, especially at the moment, because we have a lot of people with these type of issues. And so know that if you're doing this, you are actually meeting our recommendations. Okay, so what about you? So this is now the practical side of things. With this information in mind, is bone health something that you want to invest in, and why or why not? And if so, what is the next step that you can do within the next week or 2 that will help improve your bone health? So some examples might be complete that self-assessment in the Know Your Bones website. It might be find out your calcium and vitamin D levels. It might mean visit your GP, or it might mean develop your exercise plan. Good. And that's the end of our session. So I'll bring us back and I will stop the recording, and then if anyone